Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Hi, everyone. Welcome to the Population Health Management Podcast for this month. We're going to talk a little bit about referral management and the importance that it plays in our healthcare system. We're also going to touch on specifically Lightbeam's referral management module and how our teams are using that right now. Today, we have two guests with us. First, we have Alexis Edwards. She's one of our clinical transformation advisors here at Lightbeam. And then we also have Matt Cheatham. He is our Referral Management Operations Director. So welcome, Alexis and Matt.
Thanks, Laurel. Thanks for having us.
First, I kind of want to start with what your roles at Lightbeam are. Could you tell us a little bit about your experiences?
Thanks, Laurel. Again, I'm Alexis Edwards. I am an RN, and I'm a member of our clinical transformation team. We're a wing of advisory services, and we're comprised of nurses who are subject matter experts in care management. And we help our clients translate insight into action through the development of care management solutions and scalable workflows. And then we provide ongoing consultative engagement support as they deploy these scalable solutions.
Awesome. Thanks, Alexis. And then Matt, could you share a little bit about your role here?
Yeah, so my role is as the operations director for the referral management module to help our clients utilize their data to understand and build their clinical referral networks. And so what we do is we reach out to them to build their vision of how they see the workflow working in their marketplace, and how they see the referrals and the referral patterns and the optimization of their networks work within each of their clinics or practices.
So I found this really cool stat, this really interesting stat whenever I was researching. It was posted by the U.S. National Library of Medicine, National Institutes of Health, and it said that more than a third of patients in the United States are referred to a specialist each year. And then that specialist visits actually constitute more than half of all outpatient visits. And then another study had found that 25 to 50% of referring physicians did not know whether their patients actually went and saw the specialist to which they were referred to. So for this reason, Lightbeam created our referral management module and our whole team. I was wondering, Alexis, if you could expand upon the struggles of care teams who don't have this visibility into their referrals.
Yeah, absolutely. There's a number of challenges at play here, beginning with, how to select the best in-network specialty provider or facility to refer to. There is documentation to compile, and that's all compounded by a definitive lack of visibility to the outcome of those referrals that are made. And as you know, these referrals really represent critical transitions in a patient's healthcare journey. They're indicative of a patient's disease process worsening or becoming more complex. So it's imperative that the healthcare team is highly coordinated and communicating during these escalations in care. But unfortunately, these referral loops are frequently left unclosed for a number of reasons, right? There's disparate EMRs and systems, appointment delays, and time constraints, all resulting in a lack of care continuity. And often these patients aren't identified again until they're seen again. And hopefully that's by their primary care provider. But we know that a significant number of these patient missed referral appointments will result in an ER visit and a subsequent, arguably preventable hospital admission, where they'll likely be seen instead by a costly hospital specialist.
Yeah, absolutely, Alexis. And Matt, I was wondering, what would you recommend to these organizations who are looking to reduce the amount of referral leakage that they currently have?
Yeah, in order to have visibility in the network, you first obviously have to track your referrals. That is obviously a big piece of it. And that's one of the major things we do with this tool is track the referral from beginning to all the way to the closed loop, as Alexis mentioned. Building a strong network is a really key factor in this. So, but not only building the network, but also modifying the network as you see referral trends and patterns arise through the process. So the greatness of what we have in Lightbeam is we have so much data that we can use to analyze and review the networks that you've built based on your value-based contract.
Yeah, as Matt mentioned, our clients have access to their data, their analytics, and their modules. And in this instance, the care management module and the referral point module all in their end-to-end solution, which is so valuable for providers to have all of that information at their fingertips. And as part of the clinical transformation team, we help our clients create scalable referral care management programs that then give them visibility through the referral to close those loops while demonstrating improved care coordination and the ultimate end goal of better patient outcomes and higher patient satisfaction. So we see with our clients, and many studies indicate that there's really a 30-70 rule that applies here. Approximately 30% of patients with a simple referral will attend their appointment, while 70% of patients that are in a true referral care management program, will attend at least one specialty care appointment, regardless of their diagnostic or age group. So it's really important that organizations learn how to effectively navigate patients through their referral network through a sustainable workflow. Otherwise, what we often see as care managers is that we make that referral, we make that phone call, and we suggest that that the patient follow through with that appointment, but we really have no way to validate that appointment took place. And as you know, there's a myriad of reasons why patients might be forgetful or just truly non-compliant with that visit. So the solution combined with our care management module really allows for, closing that loop.
Thanks, Alexis. I was wondering, Matt, could you elaborate even further on that, how Lightbeam is working with those organizations?
Yeah, so one of the great ways we actually are able to increase that patient engagement, patient satisfaction, we have an automated referral coordinator tool that we use where we actually text the patient on a regular basis to check in with them, because we know that the patient is usually provided that referral information, but we get it to them in an automated text message so that they have the address and phone and information on that physician so that they can call. But we not only provide that information, but we follow up and ask them for the date and time of their appointment. So as part of the referral tracking process, we can see at any point in time whether the patient scheduled the appointment. And then again, we can follow up once they have scheduled their appointment to give them a reminder of their appointment date and time. And then after the appointment, we can also follow up to close the loop and get a satisfaction rating from them. So we'll actually ask them a question, how do you feel your appointment went? And they can give it a score from 1 to 5. So we follow up with that. And then we also follow up with, we allow them to write in a response as well. So, we don't want to reach out to the patient too often, but we also want to follow up so that we know that their care is being taken care of.
Yeah, that's really so important, I think, Matt, because as a nurse or as a care manager or a provider, quality is really important. Obviously, we want to make sure that we're sending our patient to the right provider. And oftentimes we work with ACOs or clients who have centralized care teams and they don't know the market as well often for some of their patients. And so if you're working at a distance or you're working with a market that you're not as familiar with, it's really helpful to have that type of information and allows us to make sure that we're, again, promoting patient satisfaction as well.
Okay, so Matt, what would you say are some resources that we can point anyone who's looking for more information on referral management to?
Yeah, so we have a webinar coming up on March 11th. You can join, and we can give you quite a bit of information in there as well. And we have a few links.
Yeah, and I'll be sure I'll add those in the description below.
Yeah, and Laurel, I think it's important for people to know that there's also resources available through cms.gov. The Innovation Center has a great PDF on managing referrals and providing a patient-centered referral experience. And you can also obtain referral certification and authorization through CMS. So those might be some helpful resources to link as well.
Absolutely. Well, thank you so much, Alexis and Matt. It was great having you on the podcast, and I look forward to our webinar together next month, Matt.
Thank you for having us.
Thanks, Laurel. We look forward to talking to you again soon.